Alex Lawson, the founder of Social Security Works, was on our program today talking about the founding, the creation of Medicare, what it was, what it means, where it was supposed to go. Check it out, ding the bell, leave your comments, share our channel with your friends, and please subscribe. Our old buddy Alex Lawson, the executive director of Social Security Works, the owner, host, producer of We Act Radio in Washington, D.C., an affiliate that carries our program. SocialSecurityWorks.org, of course, is the website. Alex's personal Twitter handle is ALaw202. To discuss, and take your questions on Medicare and or Social Security. There's the whole Medicare for All thing, and the fact that right now we're just sliding into the open enrollment period for Medicare. I believe it starts on November 1st. Is producing millions of dollars worth of television ads and all kinds of stuff. Alex, welcome back to the show.
Tom, thanks for having me.
It's great to have you with us. So first of all, when does that open enrollment period begin?
I was just going to look that up to give you the right answer, so give me a second. But because I don't think it's November 1st, I think it just started.
Oh, okay. Maybe it was October 15 then, something like that.
Yeah.
But in any case, it's either here or it's imminent, which is why we're seeing millions of dollars worth of ads for Medicare Advantage or Medicare Part C, as they prefer to call it. We were talking about.
I shouldn't have questioned you, Tom. It's November 1st.
Yeah, that was my recollection, and which is also the beginning of the open enrollment period for Obamacare, also, and a number of states are going to actually see their Obamacare premiums go down. So if you're not Medicare age but you do need insurance, that's something to know about as well. Yesterday we were talking about this, and I was, I regularly go on rants suggesting that Medicare Advantage is destroying Medicare. Basically, it's siphoning resources away from Medicare. About 20% of those resources that it siphons off goes to the profits and the executive salaries of big health insurance companies who run these Medicare Advantage programs or Medicare Part C programs. That's really not Medicare. You give up your Medicare when you go on these programs. And I got a call from someone who said that every state has a program. The one in Washington is called SHIBA. Every state has a program where you've got volunteers who are really well trained. Part 9 of the Medicare and You book that just went out to everybody around the country describes these programs. They're toll free. These are not salespeople for health insurance plans or anything like that. And that speaking with one of these people who called in yesterday said that the advisor had said that in some parts of Washington state there are Medicare Advantage programs if you don't travel a lot or if you're just going to hang out in that area that are actually better than being on Medicare, whereas in other places there's Medicare is better than Medicare Advantage. Does that make any sense to you?
So this is a tricky issue, and I think your rants are fundamentally correct. And sort of the reason I think I had in my head October 15th is that because it's such a complex issue, we start getting our information ready to send out. As you know, when we start talking about this, you get an immense amount of questions that are pretty specific to a person's individual setup. I'm not trying to dodge your question, Tom. I want to be clear that it's so complex, and that's part of the problem. That's why we do need to move to a Medicare for All system, improved Medicare for All, because there are situations where, based on a person's current health, the travel thing is interesting, and you bring it up, but I don't think everybody knows this. Medicare Advantage is really only a state-based thing, like private insurance. You have different insurers offering this, and so there's different plans. So it really isn't good if you are if you're traveling or otherwise, if you're travel for work or if you take vacations often. Medicare Advantage is not going to be a good fit for you because it actually has a network like private insurance, because it is private insurance, where Medicare, traditional Medicare, you can see any doctor or provider that accepts Medicare.
Anywhere in the country.
anywhere in the country.
Right. Whereas with this,
certain
go ahead.
With certain Medigap programs, it's actually, even international. So the fact is, it's so complex, and the health insurers, the private insurers, want it that way, so that it confuses people. That's part of their marketing strategy.
This is a feature, not a bug. The complexity.
Exactly.
Yeah. So, so just to start out, let's start at the beginning, Alex, because somebody called yesterday and said, "Would you make a video that tells me, everything I need to know about Medicare?" Let's start at the beginning. Medicare started in the 1960s. It came out of the Lyndon Johnson, Great Society program. And Robert Ball put this program together. Robert Ball later told his friends and wrote that the idea that he had discussed with Lyndon Johnson was that we'll pick up people over 65 because the health insurance companies really don't want them. They're more expensive. And so we'll pick them up as a government program. And then once everybody understands how well it works, we'll start lowering the eligibility age over a period of, maybe a decade, so that eventually everybody in the United States is on Medicare, or at least has Medicare available to them. Does that comport with your understanding of the system, and that this 20% hole that was built into Medicare, or at least into Medicare Part B, I guess it is, that was the price that Democrats had to pay to get some Republicans' support for this thing? The Republicans were saying, and some of the conservative Democrats were saying, well, people have to have skin in the game, or they'll abuse their benefits. But really what it was we want to provide a space where private for-profit health insurance companies can step in and make some money off this Medicare thing. Do I have all that right?
You do, and I'm just going to keep agreeing with you. You know this issue so well. I will say that Bob Ball, who was the mentor of Nancy Altman, the president of Social Security work, also discussed one other way of going about this, which was a MediKids program covering all kids, Medicare covering seniors, because it's completely true that insurers, as soon as a person hits 65 before Medicare, they would start figuring out ways to throw them off the rolls, because people over the age of 65 are not profitable. So it wasn't like we created Medicare, because out of the goodness of our hearts. It was because there was literally no other option there. Right. So create Medicare, then MediKids, and then lower the age on one and raise the age on the other until everyone's covered. Both of those were discussed, but the thing that was never discussed was that Medicare would become a static program that only covered seniors, and in fact, that then they'd add Medicare Advantage, which would be just private insurance, right, subsidized by the taxpayers.
So let's talk.
Holes that are drilled. The holes that are drilled into Medicare are exactly what you said. Those are the price that was exacted through the process of enacting Medicare to get the vote. So they drilled holes in it that could then be filled by private industry, and they wouldn't have to assume the risk. The big risk would be assumed by the taxpayer, and they could just basically extract some profits.
Right. So let's talk about Medicare Advantage. My understanding is that Medicare Advantage was created. It was called Medicare Part C. It was created during the Bush administration, the George W. Bush administration. I think 2005 sticks in my head, and that it was it was sort of like, your local school district authorizing charter schools. Yes, we'll allow for-profit private schools to come in as an experiment. Let's see how it works. And of course, the private schools come in, but we're gonna subsidize them. We're gonna make sure they never lose money because we want them to be successful. And so, the private schools are getting the same amount of money as the public schools, but the private schools are able to say, we're only going to pick the really good students and let them go, and then go into our programs, and the poor students have to stay in the public schools. We won't let them in. And 10 years down the road, the private schools have spectacular looking results, and the public schools look like they're failing. And at that point, people say, screw the public schools. Let's have more private schools, thinking, not realizing that this was an intentional dynamic. In your opinion, was Medicare Advantage brought about with that same mentality, that same idea, here's a way to destroy Medicare?
Absolutely. There's no doubt about it. The only thing I would add to your description, which was spot on, is that it was also created and it was sold with a saying that it was going to be more efficient than Medicare, that in fact it would save Medicare money, that the miracle of the marketplace would save money, which is often how they sell, looting public resources and turning them over to their.
Well, has it saved any money?
On Wall Street.
What has?
Absolutely not. It costs way more than traditional Medicare. We have to subsidize every dollar that goes into Medicare Advantage. So if you do it dollar for dollar, traditional Medicare versus Medicare Advantage, we have to spend more than $1 on Medicare Advantage to match Medicare. It costs more money. We literally just pay more. And let me make it easy, like how the con works. So it started failing, and they're like, oh, we need to support it because people love it. So now we need, and these aren't the numbers, but it's just to make it simple, we need $1.10 for every dollar that traditional Medicare gets. And then what they do is they take that 10 cents and they do actually give 2 cents of the dime to the people. And then they keep 8 of those cents. So it's just an automatic profit.
So this is how these programs are able to say, well, and forgive my interrupting, but we've got 30 seconds until we hit a hard break here. So that's how these programs are able to say, we'll offer dental or we'll offer hearing aids and things.
Eyeglasses, exactly.
Right. They're taking that 2 cents, but we're all, the entire nation, through our payroll taxes, we're subsidizing them. So, Alex, you were saying that if I'm a consumer and I am looking at getting regular Medicare with a Medigap plan, which doesn't include dental or vision and doesn't pay for a health club or meals being brought to my home, and I see an ad on TV that says, if you drop your Medicare and move to a privatized Medicare Advantage program, you'll get all these extra benefits. And in fact, apparently you do, and the government pays more for that. If I'm a consumer, I'm saying, who cares what the government pays for? I want the benefits. You said there was an asterisk to that. What is that?
Here's the asterisk. There are bells and whistles, and some people should look at this and say, having eyeglasses or something like that. I'm very into that. And my own health status, I'm pretty healthy. I don't travel very much. There are situations where that might make sense, because you got the bells and whistles, and there are bells and there are whistles. But the problem is you pop the hood, and under the hood is just a regular old insurance plan. And that means there are networks. You can't see whatever doctor or specialist who accepts Medicare you want. You can't. Now,
some of them claim you can. I saw an ad on TV the other day that said that you can see any doctor that takes Medicare.
So, first of all, this is the problem with private insurance, right? Then at the end of it, it's like all plans must be divided, and they speak really fast, right? There's a lot of fine print when it comes to Medicare Advantage, because this is private insurance. So
right.
A few things. Almost all of them are based on networks. They're PPOs or HMO. It's the exact same thing as private insurance before you reach Medicare age. But the big thing is also that your care can be denied. You can actually be denied care with a Medicare Advantage plan. So basically, there are situations where your out-of-pocket costs could be lower, and maybe you get some bells and whistles. But if you become seriously sick or injured, then you're going to find that this Medicare Advantage plan should just be called an insurance plan and is not actually anything different than a private insurer.